Well, September is Prostate Cancer Awareness Month, and it is so important for men to get a PSA test. To help hammer that home for us today, Dr. Mark DeGuenther joins us to discuss that. And this is, September is Prostate Cancer Awareness Month, so it is a good time to get this message across. You were just telling me, it was a fact that I was unaware of, that prostate cancer is the #2 killer of men?
The #2 leading cause of cancer death among American men.
But it is highly curable.
Absolutely. You know, there are a lot of people that hear that if you live long enough, you will develop prostate cancer. You know, to some degree that's true. There are a lot of people that also hear that if you develop prostate cancer, you're much more likely to die with it than you are from it. And that's not exactly true. When found early, prostate cancer is 90 to 95% curable. And you know, that's the real take home. When we don't find it early, it's often not curable.
But it's so easy to cure if you catch it early. So.
Yeah, I mean, there's the treatments have side effects. You know, the mainstays of treatment have always been surgery and radiation. There are some newer things out there. Something we're excited about for a small set of men with prostate cancer is something called HIFU, or high intensity focused ultrasound, that can treat prostate cancer with very little side effects. You know, the traditional side effects people worry about are incontinence, or the leakage of urine following treatment, or problems with erectile function.
So what's the message you want to get across to guys out there? Because men, like all of us, nobody wants to go to the doctor. But there are problems getting more men to go. They're the tough guy, I don't need a doctor, but you gotta go to get this checked.
Well, you do, and you know, it's not all the men's fault. Yes, men, and I'll take credit for being a man, that we're really bad about not admitting there's a problem, not wanting to face up to anything, but do it for your families and get checked. Get a regular checkup, including this. But the federal government has actually discouraged primary care doctors and patients from getting the PSA test. Starting in May of 2011, something called the U.S. Preventative Services Task Force recommended against routine screening. In my opinion, and in most urologists' opinion, their recommendation was based on poor science. And what we're seeing now is the fallout that fewer men are getting diagnosed early, and we're seeing a real resurgence of men who are being diagnosed with already metastatic and incurable disease.
So don't be thrown off by that research. There are varying guidelines on all sorts of things.
Talk to your doctor, and that's what it comes down to.
Okay, but get it checked.
Absolutely.
At what age should you start getting it checked?
If you have a risk factor, which is a family history, father, brother, or if you're African American, you should start at age 40. Generally, everybody else starting at age 50.
Okay, and a good message maybe to wives is get your guy out there and nag him a little bit. Is that all right?
No nagging.
Okay.
No nagging.
All right, just recommend them to go see a good doctor. Doctor, thanks for being with us. We'll be back with more in just a moment.